on the screen. It's going to be easier up there. This is pretend blood, but it's red dye, so it stains like crazy. Okay? So I'm warning you guys right now, if it gets on your clothes are gone. Okay? It will stain them. The other thing is, it will ruin my carpet. So please be very careful about how you use it. Keep a chuck under it at all times. There's lots of chucks floating around. It's a clamp system. It's kind of like a lever system. In a minute, I'm going to lower one down, and I'll keep one high. So when this one runs empty into this one, then you just flip it. You take the one off the ground and you put it up high. Does that make sense to everybody? That's how the arms work. We're in the process of getting some more arms for you guys. It's just a little roller clamp system, so you want to be very aware that you keep these clamped off when you're not using them. The other thing I ask you is don't take the arms next door, because what will happen is we'll track blood all the way into the other room. We're trying to keep one room bloody and not the other room. Okay, so let's go ahead and we're going to put a chuck. And again, you guys will be able to see how projected onto the screen. And I'm going to keep my empty one down low, and I'm going to open the clamp for the lower one, okay? So I'm going to open my clamp, and in a minute, it's going to run from here down into here, but I don't want to do that until I'm ready, because it'll make a mess, okay? All right, what am I going to need to gather? I'm going to need to gather my catheters, and I'm going to show you guys a couple different types. So I have my catheter. I'm going to need a flush of saline, okay? So these are my flushes right here, okay? I'm going to need something called a T-connector. And remember this one in this little package, you guys? Remember my little T-connector? It kind of looks like that. Has a little slider clamp right here. The little part where we're going to attach it to the IV, so I'll need that. What is it officially called? It's officially called a extension set, a catheter extension set. I'm going to need my Tegaderm and an IV start kit. Okay? Inside my and you guys have two of these, so just use one over and over to practice with. And I've got a couple pieces of tape here. I'm going to go ahead and get my tape ready. And I've got in here, there's some gloves in here if you want to use those. I'll use my own gloves. There's a Band-Aid, there's a little alcohol prep, and there's a gauze, and there's a tourniquet here. So we're going to need this tourniquet. Okay? Wouldn't this be great to have a new classroom right now? Instead of trying to do it from here? Okay. So you guys can kind of see his veins. And I will tell you guys, these, we're in the process of buying new ones. These guys, you may or may not get a flash on, and I'll show you that, but you'll kind of have to get a feel for whether or not you're in the vein. I am definitely going to wear gloves. Make sure you're practicing with gloves on, because you'll feel the vein differently than if you don't have gloves on. Yeah. Yeah, they're not sterile. Yeah. Okay? Okay, guys, so I got to find me a vein. How am I going to do that? I can either use the back of the hand. You see he has some on the back of his hand there. I'm just going to do his forearm just for the benefit of you guys. Okay? I'm going to go ahead and put a quick release tie on here. Let me show you how to do that. Okay? So when I come around, I'm going to put my non-dominant hand underneath. I'm going to switch and bring it across the bottom. Did you guys see how on my non-dominant side it's coming across closer to me? And then I'm going to take this, wrap it around, and do like a quick release. Did you guys see how I just kind of did that? So it's kind of practice how you get used to it. And you want it kind of snug. Okay? And then if I need to pop it, I grab this and it's a quick release. Just like you guys tie when you tie your restraints down. Okay? Next, ooh, that one looks good right there. I'm kind of looking around, finding what I like. Okay, I found one that I like. I've explained to my patient. I open my gauze and I start center and work my way out, making big circles. And I'm going to let that dry while I'm pressing everything else. So, what I'm going to need to do next is take my normal saline and make sure that that there is no air in it.
Camera battery. That's my charger.
Okay? And don't lose these caps, you guys, because we want them for testing, and they get lost easily, so if you guys could just help me to save those caps. Then I'm going to come over here, and this is all sterile, so I'm opening this, and it's sterile. I'm going to open away from me. And I'm going to go ahead and leave that in there. I'm going to connect this up to this, and I'm going to unclamp this, and I'm going to go ahead and prime my line. In other words, I'm going to prime it through until saline comes out the end right here. Then I'm going to clamp with my slider clamp. Okay? So I just did my slider clamp. Now I'm going to leave that sitting there ready to go. I also have my Tegaderm ready to go as well. And I have a little bit of tape. Okay, so there's a couple of different types. This one is a Protect IV. This is a 22 gauge 1-inch. And then I have one right here that is a 20 gauge 1.1/16 of an inch. Okay? These actually have safeties on them. I'm going to show you them. Yours do not have safeties for practice. Okay? I'm going to get a couple. Sometimes it bleeds a little bit. What I'm going to do is just have a couple of alcohols ready to go, just in case I need to open and clean my mouth up. Okay, so my gentleman he's all cleaned and his alcohol is drying. So I'm going to go ahead and get and tie. How's that? Is that a good distance for you guys? Okay. Here's my catheter. I'm going to pull this out. Now, this little button right here is my safety. Right there, that little white button. So I don't want to hit that. That retracts my needle. I'm going to come over and I'm going to stretch the vein. And I can go ahead and turn my blood on at this time. Now again, guys, I may or may not see a flash. I'll explain to you what a flash is. We'll try it here. Let's see if I can get this running. I'm going to try. Okay, so I'm going to go at a what degree angle? 15 to 30. I'm going in, okay? And then I just kind of push it all the way through, and you can slide it up like that. Now, what's going to happen if you're in on a person? You're going to get something called a flash. A flash means that blood comes back into the cannula. On the mannequins, I may or may not have hit it right now. I'm not going to worry about it. But a flash means it came back. 100% of the time, you must get a flash to know that you're in the IV. Okay? On the mannequins, not so much. On a person, 100% of the time. Now, if I pull this out, and I'm in, which I know I am, but it may not bleed back, then what I've got to do is I've got to occlude. Where's the end of the cannula? Right over here, right? So I've got to occlude here, and then I've got to get this thing ready, because once I pull this out, it's going to drip back on me, maybe. Okay? So I'm going to go ahead and take this cap off. You guys see a lot of coordination here? And then I'm going to pull back. And as soon as I pull back, and it's not bleeding back, but don't stress over it. You guys can't see that. I know you can't. But don't let go. This thing is like vibrating and stuff. Don't let go of this, because if you let go of that, it's automatic failure of skill. Don't let go of anything. So I'm going to quickly activate my sharp. I just push that down. I'm going to reconnect this up and tighten it down. What do you think the next thing I would do would be? Pop the tourniquet. Because if you don't pop your tourniquet and you try to flush, you will blow the patient's vein. You have to pop the tourniquet. Okay? So the next thing I'm going to do then is you guys see how I haven't let go of this? Okay? I'm going to go ahead and unclamp my slider clamp, and I'm going to first aspirate. Okay? Oh, look, did you guys see I got blood? Yay! Okay? There's my blood, and I'm going to give it just a couple of cc flush. I know I did. Wonderful. Okay? Now, what am I going to do? Tape it. That's right. If you want to reach over and grab a piece of tape and just kind of go like that for a second, just to hold it so you can let go and get your Tegaderm ready, that's okay.